All right, so welcome everyone to our session today, Leading in a Hybrid Workspace, Moving Our Teams from Surviving to Thriving. This is the second in our series, Spotlight on COVID-19 Recovery webinar series, and today's session is in collaboration with Children's Mental Health Ontario. So we're really excited to bring you this session today. We have a number of different panelists who are going to present some sector perspectives, and they're also going to share what the literature says about this topic and engaging our teams and continuing to work through this hybrid workspace. So we'll go. So you can see in the next slide the agenda. So our plan is just to have some opening remarks, and then we'll move into a few housekeeping notes, as well as the panelist presentation. So as I mentioned, we'll have a variety of different panelists to present some sector perspectives, as well as what the evidence says and what the latest evidence is saying about moving forward. We're then going to have a focused discussion, so we'll have a chance to hear from all of our panelists, and then we'll just flow into the audience Q&A. So we'll give you a few reminders about the Q&A portion, but we do encourage you throughout to contribute your questions through the Q&A tool. And then we'll wrap up the session at 1 p.m. Okay, so I'd like to give a warm welcome to Tatum Wilson, and he's going to open our session today. So Tatum is the CEO of Children's Mental Health Ontario, and he's worked in the health and social policy environment for over 20 years. Tatum is a passionate promoter of equity and social justice, and he's overseen the first comprehensive mental health and addiction strategy, as well as managed Ontario's first poverty reduction strategy, among various other projects and initiatives he's been involved in. So without further ado, I'm going to hand it over to Tatum.
Thanks so much, Julia. It's always shocking and alarming to see an old picture pop up and how different I look on camera right now, but I am still the same Tatum. But yes, thank you so much. Just want to welcome everyone and thank you for joining us today on a webinar on leading in hybrid workspace, moving our teams from surviving to thriving. It's worth noting that we are recording the webinar and we will be able to share a copy of the recording after. As mentioned, I'm Tatum Wilson, the CEO of Children's Mental Health Ontario, and I'm really, really pleased to join today. And we're also really happy to co-host this webinar in partnership with the Knowledge Institute on Child and Youth Mental Health and Addictions. Before we get started on the formal part of the webinar, I would like to offer a land acknowledgement. As this meeting is occurring in a virtual space and participants are from across the region, I would like to acknowledge the traditional lands and territories from where each one of you is standing. We would like to acknowledge that we are joining from across Ontario on land that has been inhabited by Indigenous peoples from the beginning. As settlers, we're grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. We recognize that Indigenous practices of health and well-being have been in place in this territory for over 10,000 years and are maintained to this day. And as healthcare leaders, we have much work to do ourselves to do our part and support the decolonization of children's healthcare systems. I would also encourage you over the coming minutes, and as long as you need to consider your own relationship with the land acknowledgement. And I know that I can't on my own cover everyone's perspective on this. So just want to lead with that and make sure that we all keep that in mind as we do our work. The COVID-19 pandemic has changed so much in all of our day-to-day lives, ways of doing, our routines and practices, and including how we work. Since the start of the pandemic, we saw how child and youth mental health agencies were able to pivot to virtual care and ensure the continuation of service delivery. And as someone who's a new dad, I give so much credit to your ability to be able to do that. And we've also seen many innovations emerge. And we certainly have learned a lot. As agencies shifted to virtual care throughout Ontario, we worked on a collaborative project with the Knowledge Institute to learn about the process of implementing virtual care and the impacts on clients and survivors. So while many of us jumped into remote virtual care and hybrid work early in the pandemic, today we continue on our collective journey about what it is to do hybrid work, what makes it work, and what makes it sustainable. As we move from what was a crisis and rapid response into recovery, what have we learned and what should we consider next? I'm really excited to participate in today's panel and to learn from the literature and best practices on hybrid work, and we hope you are too. We for sure acknowledge that there's been a lot of creative innovations and creative solutions that have been developed, and we want to gather these thoughts together and thinking and just make sure that everyone has an opportunity to learn from each other and share those best practices together. And like I said, already get some perspective on what some of the best practices and evidence is that's already out there. So with that, I'm pleased to pass over to Pranima to kick off before we head into the panel discussion. Pranima, please go ahead.
Okay, we did have a few housekeeping notes for you, so maybe we'll just go to those housekeeping notes quickly, and then I will pass it right off to Pranima. So, housekeeping notes. So we encourage you throughout, as I mentioned already, to submit and upvote any questions using the Q&A tool. This is going to help us later on because we have plenty of time to discuss those questions in the audience portion towards the end of the session. And the other piece is we also encourage you to participate through the chat. So Amanda's going to periodically put some questions into the chat. I know she plugged in there already. Where are folks tuning in from? It's just nice to hear who's on the line and who's attending. Makes it a bit more engaging as the session proceeds. So feel free to participate in the chat as you listen along as well. And then as Tatum mentioned, we are going to record the session. So know that this will be available to you. We'll post it on our website and we'll send out an email to all folks who registered for the session, just to let you know when that recording is available and when that's up. We also have, if any technical questions arise, we do have a colleague's email there, so feel free to jot that down in case you have any issues as you're listening along. Okay, so now we're going to move into our panelist presentations, and I'll just introduce Pranima shortly, and then I'll pass it over to her. So Pranima Sundar is going to introduce our topic today. So Dr. Pranima Sundar is the Executive Director here at the Knowledge Institute, and she has over 25 years of experience in community-based research, evaluation, implementation, and knowledge mobilization. Most of you on the line will know her and will have worked with her quite a bit. She's also an adjunct research professor in the School of Social Work at Carleton University. So we're pleased to have Pranima present some of the literature and what the latest evidence says, as well as, of course, her insights as a leader during this time. Take it away, Pranima.
Thank you so much, Julia. And it's so lovely to see all of your names and organizations on the line. We're really, really excited about this next round of webinars that we're hosting, really just focused on how do we get through this last bit, hopefully, of the pandemic, and how can we thrive thereafter. So I get the privilege of showcasing what our team has been working on in terms of pulling together the latest evidence on hybrid work. So as Tatum said, you know, the pandemic has changed so many parts of our life, including the way that we work and interact with our colleagues and our clients. And so over the past couple of years, folks haven't just transitioned to a hybrid service delivery model, but also a hybrid workspace. So we thought we wanted to take a few minutes and just introduce the notion of hybridity and what this means for our work in the children's mental health sector. So as you probably imagine, in this post-pandemic workspace, hybrid has become a bit of a catch-all phrase with lots of blurry definitions. So it's not straightforward. So we wanted to take some time to unpack what this is for all of us on the line as we move forward to try and implement these kinds of hybrid situations. So hybrid work is about, from my read of the literature, three main things. It's about where we work, it's about how we work, and it's about how we interact with one another in those work kinds of environments. And it's the combination of the options that exist within each of these that really constitutes what hybrid work is. So if we think about where we might work, we can work at the home or we can work in the office. We can have transient shared workspaces, which are places like coffee shops, working while you're traveling, work collectives, or hoteling. And you can also split the time where you're working. So you can have sometimes in the office, sometimes out of the office. And so, where we're working has become much more diverse than just getting up in the morning and going to your workspace. And how we work has also changed. So now we have tailored work hours. So for some folks, working from 7 to 3 is what works best for their life. For other folks, it's 9 to 5. For other folks, it's 10 to 6, and so on. So it's really tailoring the work hours to the individual's needs and preferences. And in some cases, condensing work weeks as well. So I think people have, there is this notion of a compressed work week, which kind of has existed for many, many years. Now that's become more common, where people are pushing, working more hours in 4 days and then taking a 5th day off through the traditional work week. I think what's most interesting to me is how we're interacting in this new hybrid space. space. So we have some staff members that are in the office, some people who are in the office all the time, like myself. You have others that are always remote. And then you have some people who do a mix of both. Then you have scenarios where you have people that work at home most of the time, but come in from time to time for a mandatory in-person meeting. Then you have some people who work from home, most of the time, but have to deliver therapy in person. You have different employees working in different geographies at different times and so on. That's something that we've experienced here at the Knowledge Institute, where we used to, as a department of the Children's Hospital here in Eastern Ontario, we required that everybody live and work here in Ottawa. That's not the case anymore. We're able to recruit the best talent from all over the province. And so, it's opened up lots of opportunities in some ways. So there are lots of benefits to working in a hybrid kind of environment. But you have to be careful, because you need to have a conscious implementation of a model that maximizes benefits and minimizes challenges, but also considers the unique needs and goals of your organization. So what are some of the benefits? Flexibility of space and time. I know tons of people who are saving hours and hours and hours of their lives by not being in the car. You also have streamlined processes. So, often you'd come into the office, you'd have a meeting, usually the first 5 to 10 minutes is spent kind of, getting yourself settled and organized. That doesn't happen anymore. We kind of get to business fairly quickly. Online when we're meeting virtually. We also have lots of opportunities. There are many people who take, to actually take a lunch hour when they didn't used to do so when they were in the office. So they go for a run, they go outside and get some air, they connect with nature in their own backyard. And there's also a real sense of autonomy and personal agency when you're able to sort of craft your own workday from home. Or choose to do that within the office. And what we're noticing is that there's a lot more satisfaction across our team members here at the Knowledge Institute, but we're hearing that across the child and youth mental health sector and even more broadly than that. And the other benefit, like I said earlier, was you have access to a large talent pool. So when you're not requiring that somebody be present in the office, you're able to recruit from all over, in our case, all over the province. In other folks' organizations, maybe it's even broader than that. But the flip side of all of this is that there are some challenges. So there are boundaries and there are issues with proximity. And there's something called a proximity bias. And so you have, some individuals that are in the office all the time, and often you have leaders that are in the office because, there are certain responsibilities and so on. People need to be on site for different things. And so this notion of, people are favored because they have more face time with leaders in the organization, or because they just happen to be down the hall. So it's easy to just pick up and walk down the hall and ask a quick question, that rather than calling somebody on Teams or picking up the phone and having to arrange a meeting. Another challenge is the longer work hours. And this is part of the reason why I work in the office, is because I was having a really hard time tuning off. So I had my work day started at 6 a.m. and didn't end until probably close to 8 p.m. because of all the meetings, and because I wasn't able to actually shut off because my laptop was right there. It was within viewing distance. And so this idea of, not having a boundary between my work life and my home life, and the long work hours make hybrid work a real challenge. You also have this idea, and this is starting to hit people as well. It started probably a few months into the pandemic, where people were reporting feeling very isolated and really craving that socializing. And so we did lots of things in our organization to try and increase the quote unquote FaceTime, the virtual FaceTime between our team members, trying to organize different events and different sort of casual social gatherings, because we were really missing that bumping into one another in the kitchen, having a tea, taking a coffee break, having lunch together, and so on. The other sort of challenges are not going to be a surprise to folks. You have screen and meeting fatigue. I think I sit in this spot for a long time every single day, and so I'm staring at a screen a lot. I also have meeting fatigue, like many of you. There are also technical issues, and so, right now, our technology is working really well. Sometimes on meetings, it doesn't work so well, and so there's lots of problem solving that needs to happen. And I think the biggest challenge from my perspective for our organization here is there is this sort of risk of developing two completely different organizational cultures. So you have one that's sort of more, used to folks that work at home and have all that autonomy and all that sort of flexibility in their workday, versus those who are coming into the office. There's lots of advantages to coming into the office as well. So you're kind of the risk is that there is going to be this real in-group, out-group kind of vibe that emerges within in an organization. So those are some of the challenges with the hybrid work model, and we're experiencing a lot of those, but the literature is bearing those out as well. So what does this mean for the child and youth mental health and addiction sector? Because some of the benefits of hybrid work might not extend seamlessly into our sector, because working from anywhere doesn't really support mental health work that requires confidentiality, crisis intervention, or in-person care in all situations. So these are the kinds of things that you have to be aware of within our sector that make it unique, but also create some additional challenges. So virtual mental health care, as Tatum said, we pivoted very, very quickly in our sector to delivering virtual care. But post-pandemic, we have to think about the fit between that modality and the individual's needs. Sometimes you do have that need to have space. You do have that need to have young people and children in particular that are able to move around and so on. And sometimes the technology can be difficult to do that, to execute on that. So, blended care through hybrid work, if it's implemented with care and with fidelity, it can enhance accessibility, it can enhance client autonomy and accountability, ensure continuity of care and so on. But it can also have negative consequences for the care provider. So clients' expectations around response time can make practitioners feel obligated to be consistent and constantly available, which can then affect your own work-life balance and well-being. So as leaders that are working in this kind of hybrid workplace, what do we need to do to support our teams? There really is a new skill set that's required. We need to be communicating more, coordinating more. We need to be adaptable. We need to be able to pick up on cues that are happening through the screen. We need to really hone our emotional intelligence. So, the hybrid work environment really does present us with some complex challenges. And the literature is bearing this out as well. So survey data is showing that leaders in this new environment really do feel a bit stuck between doing their job and making sure that we're meeting our deliverables and meeting staff expectations. And so some of what we're experiencing is, needing new tools and methods to help us to meet the needs of staff while also meeting the needs of the expectations of our organizations. We need to manage those power differentials. We need to ensure employee visibility, even when it's not physically in the office. And we need to make sure we're always balancing sort of individual needs with the collective sort of responsibility we have as people that are providing care throughout the province. And so I'm really excited to hear more from my colleagues on the panel, many of whom have been doing this kind of work, leading these hybrid sorts of environments for many years. So I will pass it back over to Julia to get us to the next speaker.
Great. Thank you, Pranima, for sharing some important insights from the literature and also some of your own perspectives as well during this time for our sector. So now please join me in welcoming our next speaker. So Andrea Roberts is the CEO of HANDS, the Family Health Network, and she's going to share her experiences as a leader in the health sector. She has over 20 years of experience and has previously worked as a director of family health and health analytics at Wellington Dufferin Guelph Public Health. She is passionate about system change, and she's worked on several local and provincial level initiatives, such as Moving on Mental Health, Children's Report Card, and the Lynn Maternal Child Health Committee. So I'm going to pass it now over to you, Andrea.
Thank you so much. And thank you for having me today, just to share some of the learning that we've had at our agency in HANDS. So next slide, just as a starting place, I think it's important to ground our thinking about hybrid work. And I find it helpful to remember that work is not where you go, it's what you do. And also it's about empowering your employees at home, in the office, or wherever they are. Sorry, the next slide. In today's hybrid world, it's no longer enough to solve the challenges for remote work or support a safe office reentry. It's really about finding solutions to be able to have an organization that thrives and is innovative. Next. So just a little bit of historical background. So hybrid work was not new to HANDS. Prior to the pandemic, 87% of employees worked from a defined office site. We had 4.5% working from home and 8% of our staff working in a hybrid setting. And currently, since the pandemic, we have 52% of employees now working from home, 40% in a hybrid setting, and 8% are working at a defined office setting. We have 250 employees at Hands who work across 8 sites in northeastern Ontario. Within 10 days of the pandemic announcement, 95% of our staff were successfully transitioned to working from home. The IT team had infrastructures in place prior to the pandemic, and so that really helped support that quick transition. And because of that, our clients did not experience any significant delays in services. And so again, as a result of the expansive geography that we cover at Hands, we certainly have had some previous experience with hybrid leadership. So as many of you did, we learned a lot about what works and equally importantly, what doesn't work about leading teams in that hybrid space during the pandemic. And so we'll just talk a little bit about what some of that is for us. So some of the things that were really important was about clear communication and open dialogue. And we found that that was really key to employees feeling supported and helped establish trust in working in that hybrid world. We started with guiding principles to guide sort of the work that we did during the pandemic. And the guiding principles included transparency, tools, training, and trust. And again, with transparency and communication being critical. We maintained frequent and fulsome communication with all staff throughout the pandemic, and we found town hall meetings were especially helpful for 2 reasons. The first is that everyone heard the information at the same time and heard the same information, and also had the opportunity to ask questions or clarify kind of in the moment. And it also provided a regular check-in as an opportunity for connection, which was really important early on in the pandemic. Sorry, I think the slides are a little bit behind. Can you go to slide 11? It says fostering transparency. One more. Sorry, thanks. I'm trying to go quickly through because there's a lot to cover. Okay, so we distributed, we did ask for, sorry, now I'm out of order. Okay, so we did ask for and acted on feedback from both staff and clients about how the agency was responding during the pandemic, which really focused on that switch to virtual or hybrid work. And so surveys were distributed in May of June of 2020 to both employees and clients, and all of that information was shared at town halls and also fed back to clients through our regular communication channels. Next. So at the onset of the pandemic, we had clients, 44% of our clients said that they wanted in person, 18% expressed an interest for online, and 38% expressed an interest for a combination of both. And of those that wanted both, 49% said they favored in-person services, and 54% reported little to no concern with returning to in-person services even during the pandemic. And interesting, those numbers have changed over time. So if you look at the onset of the pandemic, 74% of our employees said that they were adjusting well to very well working from home. 90% were clear about the work expectations and the deliverables. 85% reported that they had the support and direction they needed from managers to accomplish their work. 80% reported they were receiving the same or more support and direction working from home, and 90% reported that their productivity was at least 80% or greater. And then we repeated that in April of 2021, and we had 23% reporting a preference to work from home 5 days a week, which was surprising to me. That's lower than I thought it would be. 92% reported they were equally or more productive working from home. 98% reported they believed their work quality is the same or even better when working from home. 81% reported that they had the necessary tools, both the equipment and the technology, to work successfully in a remote location. And 62% expressed preference for flexibility, so the ability to be on site or at home, whichever was needed in the future. So the other piece that we learned during this was the importance of providing tools. So in a quick transition to virtual services, we had to provide lots of tools and resources to our staff so that they could successfully work virtually and work from home. And it wasn't just about the technology, but it was also about clinically support, to how to be supportive clinically, and also for their psychological and health and wellness as well, so that we could maintain our staff as they worked from home. And so we developed a number of tools and resources. The next slide shows one of our resources, the Working from Home Toolkit, and this is just a snapshot of the table of contents and an example of what's under one of those subject areas. And so the toolkit included resources that were shared that could be shared with clients as well as staff, and from very simple things like how do you connect a video meeting for therapy to more clinically important conversations. Next, again, around employee mental wellness, we had virtual coffee breaks, bi-monthly virtual site meetings. We switched our annual agency-wide gatherings to an online format where we delivered lunch to everyone's home so that we could still have that time of sharing, breaking bread together. And we had scheduled wellness activities virtually, including yoga, painting, trivia games, nature walks, and book clubs. One of the tools that was especially important was the decision tree. And that was used initially to help managers with decision-making about where an employee should work during the pandemic. And we continue to use that tree sort of throughout, because it allows us to change the decision as the work context changes. So I know you can't really see this, but the assumptions are, sort of what grounds your decisions. And as the context changes, your assumptions change. And so it allows you to sort of open up or become more restrictive about where people are working, depending on what's happening. And I think this really supports the employee need for flexibility because it puts the power in the hands of staff, and it lets them know we trust that they can make decisions based on a standardized criteria and lens. And I'll skip over the tracker and go to training. Again, training was a really important piece to have in place for our staff. We had specific training sessions for all programs that were delivered virtually, including our IPAC policies and processes. And so keeping it fun and entertaining, of course, in the virtual context was really helpful as well. And here's just an example on one of our IPAC training. We created a Jeopardy game with prizes from someone's basement because no one could go out and buy prizes at the time. And so that was really helpful at bringing a bit of levity as well as providing the information folks needed in that virtual environment. Also, I mentioned a snapshot of the document that we created for internal leaders to guide planning for required training for employees. And we really wanted to make sure that the training included best practices and standards by all of the colleges that were represented by our employees. And so training was offered to all clinicians from all agency programs. And also we developed specific training for managers about how to manage remotely, how to manage those teams remotely. And there were a number of 2 to 3 day in length, sort of over, half day sort of pieces of some of the training that we offered to managers. And also virtual training sessions and Q&A for clinical staff, right? About the technology, about best practice clinically, how to transition from paper-based to electronic-based assessments and resources, privacy and confidentiality, those kinds of things as well. Trust was really important, and from the perspective of fostering trust 2 ways. Employees needed to know that we trusted they were doing what they needed to do working from home, and the employees needed to know that we trusted them, but also that they could trust us to keep them safe and healthy while they were doing that. So again, Pranima mentioned earlier the importance of communication, regular and fulsome communication, Q&As, surveys, a way for staff to really feel like they were engaged and that we were hearing what they had to say. So that brings us to sort of more the future, and our hybrid leadership is here to stay. And so the new challenge, of course, is how to build back better. From the very beginning, I said to our senior team, going out is not hard. It's the coming back that's going to be the challenge. And so we started to think about that early on in the pandemic so that we would have a plan for returning to office in a number of potential scenarios or contexts, including a hybrid environment. And we also said to staff, we're going to take time to think about this and to really be deliberate. And so we are not going to have an answer for you in the immediate future. Hang with us as we work this through. And so we currently have a flow committee, future location of work, who has 7 subgroups examining risks and opportunities, developing policies and procedures, identifying risk and risk mitigation, and also aligning all of those decisions to our new strategic plan. So we began developing a framework and guiding principles in order to develop a sustainable work location framework properly situated in the current context, adaptive to future needs, and also position us to be a leader in service delivery. Of course, employee engagement is crucial. We had a survey distributed with 139 responses to date. Client and partner surveys have been developed and will be ready for distribution soon. We also worked with an HR consultant who led focus groups with all teams in the agency around getting their perspectives on the location of work, what they felt we needed to consider from a client's perspective, what about teamwork, what about maintaining our culture, and also getting a sense of what were some of the fears or concerns that they had. And so very interesting results. For employees' perspectives, there was a strong preference for having flexibility where you could work from home as an option some of the time, not all of the time. An option to work from home was seen as a positive factor in recruitment and retention. There was certainly preference for that hybrid model, allowing for what's best for client preferences and needs, as well as staff preferences and needs. And also having it be possible to work efficiently with more clients. Staff felt that it was possible to work efficiently with more clients than they could have imagined, and also with equal efficacy. There was concern about isolation in terms of teamwork, recognition that what's possible with respect to virtual work will vary based on operational needs and client needs, and also that direct in-person interaction with coworkers periodically was said to be very important. In terms of maintaining the culture, the virtual town halls have been very effective, as have our spring and winter gatherings remotely, use of tools like SharePoint to give access to information that people required very quickly. And also our culture club was cited as a benefit, and we'll continue to focus on how to adapt the work of that group into our future model. Fears and concerns, there was fear, of course, they would lose the flexibility that they've had in working from home. There were decisions about, they believed that decisions about program work should be made by program managers and not higher up in the agency. And there was a worry about that perspective being heard. And also new staff, interestingly, new staff experienced concern about going into an office when they've never actually been in an office. And we actually hired a number of people through the pandemic who've never set foot in one of our offices. We took over offices for people that were used to be in the office when they moved home to create space for people who had to be in the office. And so there's a whole sort of shifting around that needs to happen as well. In terms of next step for HANDS, we do have a work plan. Right now, we continue to be in our planning phase until the end of June, preparing between July and September, and our implementation with all our policies and procedures and training and pilot tools in place beginning of October of 2022. And then we'll continue to monitor and evaluate as we move forward with that. If you would like any more information or happy to have a chat with anyone or share any of our resources, you can contact either myself or Dr. Tina Benavides at HANDS or our friends here at the Knowledge Institute for more information. Thank you.
Thank you, Andrea. We really appreciate you sharing those tools. I know it was really interesting to see that decision tree and how you folks use that and continue to adapt that as the pandemic continues on and as we continue to be in this hybrid work situation. So next up, we have Karen O'Connor, who's going to present another sector perspective. Karen is the Senior Director of Community Health Services at Loft Community Services in our sister sector, the Adult Mental Health and Addiction sector, and she is a senior leader there and has co-chaired the Provincial Early Psychosis and Intervention Providers, as well as an ongoing advocate for young people and their families. Over to you, Karen.
Great, thank you. And hi, everyone. Andrea, great. I was taking notes as you were presenting, so thank you. So I'm here to talk to you about our experience at Loft, and we really believe that the hybrid workplace is here to stay, and planning is really focused on that. If you go to the next slide, just to give you a bit of perspective around Loft is, it says here we have 700 staff. We're actually up to 900 staff. We've grown quite a bit over the pandemic, and our geography spans from South Toronto up to Orillia now, with different staff hubs. In the child and youth work, we have a few main roles. One is counseling. counselors, we have residential staff, we have care coordination or case management staff, and peer support workers. On average, we serve about 800 youth per year. So that was just to give you a little bit of information about Loft. You go to the next slide. So as I said, we right away looked at pulling back in some of the direct service areas when COVID hit, but never entirely gave up some of the in-person work with clients. And some of the rationale that was put out there, and which staff certainly agreed with, is that in many of our programs, we're serving people with complex mental health and substance issues. And so the ability to do everything virtually is just not an option. But certainly people did start to work from home. And so a hybrid workspace for us is evolving. People maybe who have been doing more work from home and less in person, now it's starting to shift to more in person and less at home work. If you go to the next slide. As we've made this shift back, absolutely employees want a rationale for why more in-office pieces. They want safe office spaces as well. And one of the things that our health and safety and our IPAC teams have needed to engage and look at what is the standard across our workspaces. Do we need external people to come in and assess the workplace to make sure that we are doing everything we need to do in those workplaces to make sure that people feel safe being in them? You know, what's the limits in terms of people being in the office in terms of numbers? Are there supplies available? What's the screening when people come into the office? Those were important pieces that we continually have revisited. The other piece, and Andrea talked about this, was surveys. We had a number of surveys throughout the last couple of years, not only of employees, but also of clients around what their experience has been in the different modes of service delivery. And key was reporting back the findings to the employees so that they could see clients were saying, you know what, like some of the new virtual groups that are happening, but I still need to see people in person for these reasons. Or family members going, you can't disappear on me. You know, we do need some intervention. Let's figure that out. So the surveys were incredibly, incredibly helpful. You go to the next slide. As Andrea mentioned, you know, those mechanisms to hear from staff was really, really helpful. Our CEO had town halls where we would talk about different items related to the organization, but it was a great opportunity for staff to engage directly with the CEO, to ask questions around why things were rolling out the way they were, what the approaches were. During that time too, you know, previously we'd had an HR manager. We ended up hiring a senior people and culture person. And I've even heard people say, you know, we're thinking about hiring a chief happiness officer, really thinking about that culture piece and what it is we need to do to engage employees in the work that we do, to be inspired. And COVID as well has made recruitment really challenging. So you'll hear me talk a bit more about that person, that's the senior person at people and culture, has become really pivotal at our organization. So the surveys, we did the non-for-profit employee of choice survey. We wanted to see how did we measure up with other organizations on different areas. And so that was really great feedback for us as an organization. We had probably the highest response rate we've ever had for an employee survey as well. And it touched on all different areas, but it was that comparative factor that was really helpful for us as senior management to see how we were doing. Agenda items on team meetings was really important, checking in with people around what their needs were in this hybrid model. I know particularly in our youth teams, people were starting to experience some isolation. Not seeing their colleagues. So much of our programming is driven by the energy of our staff, and not being together was really challenging the longer that COVID went on and has gone on. To be nimble, we moved from just formal team meetings every week to what we call huddles. So I have 12 middle managers that report to me. And what we do is we have a 45-minute huddle on Monday mornings. And you can almost imagine standing around a table and you're just walking through quickly agenda items, but it was a really great way every week to surface what was coming up in the different workspaces. And often issues would come up around, or just they could problem solve together. It wasn't always coming up to me. And so those weekly huddles continue and people love them, and they're virtual. But people say, you know, they've never felt like they've worked more like a team as they have during the last couple of years with these virtual huddles. Also, as a senior management team, we continue on Wednesday mornings for 45 minutes to do a virtual huddle as well, which is really about emerging issues that we need to solve quickly or respond to or get on our agenda for our senior meetings. So those were great mechanisms to hear and have it bubble up from staff what was going on in the organization, continue to be very valuable. Next slide. Policies did change and were put in place. So doing virtual care, our privacy policy had to be updated to include virtual care. We needed to train staff in the new privacy policies and consent policies around virtual work. We also had to talk about work from home. You know, what equipment was the organization supplying or not supplying, and that informed policies and procedures for work at home, the work at home, because it came up quickly. Oh, you know, I need to increase my Wi-Fi. I need a new office chair. You know, I need an assessment because I don't think my workspace is suitable at home. Those things, again, I'm talking about HR, really, really helpful, and health and safety issues. So having those people in place and being able to hear about these things and respond to them quickly really increased, I believe, employee satisfaction and feeling like they were being heard. I talked about privacy in the context of virtual care. And as Andrea mentioned, training in that area, but updating our policy. The other piece too that became a challenge is how do you do that really important work around diversity, equity, inclusion? You know, the death of George Floyd in May 2020, the, you know, discovery of the graves in Kamloops, and what are we doing around truth and reconciliation? And people really pushed for us to continue and to look at that work, even though they're pressing client concerns, they were saying to us, look, this is an important part of my work and satisfaction, is knowing that law community services is addressing these issues. And so the CEO with a consultant did engage staff in an anti-Black racism caucus or working group to start to formulate recommendations for law in those particular areas. So that work needed to continue in this hybrid space. And I would say people's comfort with virtual was fantastic because it allowed us to engage staff across the geography and to participate in committees like that. So I think the learning too was just around committee work. How could we engage people across the organization efficiently? And virtual allowed us in these hybrid spaces, and learning from those allowed us to do that. I think too, I mentioned the infectious disease and vaccines that, you know, with people coming back to the office or people working in residential spaces, going into client homes, we had also what we called the response team at Loft that met every week for a long time, so that we were developing procedures and keeping up to date with all of the demands from funders around, you know, how much testing do you do? What kind of equipment do people need? And also too, we had a couple of what we call the North Stars, where we consulted with them continually. University Health Network, Sunnybrook Hospital is engaging those infectious disease experts from those two facilities in particular. And that gave staff comfort knowing that we were consulting with experts in the field around what our policies and procedures were, and especially as things shifted and changed rapidly. Go to the next slide. Human resources. Unbelievable the pressure I think that department has been under, and our people and culture, not only around recruitment, but, you know, vaccine mandates, and also making sure and supporting us as a senior team, and really looking at how are we connecting to our employees, how are we making sure that we have our finger on the pulse. IT, wow, they got smoked during this. People needed, you know, our calls, and we have a ticket system. The calls went up and through the roof. And so we realized very quickly, if we're going to support people in hybrid working places, we needed to increase and support and be responsive to what people's IT needs were, and that they could. We do staff orientation and training on an educational platform called Absorb. You know, it needs to work. We need to make sure new employees get set up on that. So IT, I think, was the other area that we learned quickly needed to be supported. Communications, yeah, about everything. One of the things our CEO did during the last couple of years as well is she invited people to send anonymous notes through a portal. If there were things that were bothering them, that they had questions about, they could send those in anonymously, and those were brought back to the senior team. And she also could respond to those, but it was an opportunity to get that feedback. If you go to the next slide. Oh. Is that the last slide, Amanda?
Hi, Karen. No, there's still a couple there.
Okay, great. Okay, thanks. I would always say too, we learned middle management, what incredible pressure they were under to take messages from whether it was our response team, from our huddles, and sharing that back with staff. And it was a big change for everything to be done online. And so it really showed people that were struggling to learn how to do that. And so lots of support and coaching with middle management about this will be a change for people. And to continually, I know in supervisions that I had with middle management, was checking in around things like personnel, hybrid, even for themselves, is looking at how often are you in the office, how often are you in the residential setting, to make sure that there were standards around that and equity across the programs. And in the beginning too, we asked staff to put their cameras on. Some staff wouldn't put their cameras on in the beginning. And so it was supporting middle management in some of those messages as well. If you can go to the next slide.
I'm just going to give you a quick time check, Karen. We're getting a little close. So if you want to just sum up this portion, that would be great. Thank you so much.
Sure, I think I'm on my last slide, so I will do that. I would highlight the last couple of bullets. But most importantly, probably the last one is to walk the walk. If we are asking people to be in settings, residential settings, office settings, that as senior leaders, what we found, it's really important to be there as well, and be able to model the hybrid approach, having our cameras on, not looking on our phones when we're in meetings, just some of those basic protocols to really support culture as we move to a hybrid workspace. So thank you. I'm going to end there and hand it back to the facilitator. Thank you.
Thank you so much, Karen. That was great. Thanks for sharing what Loft has been doing during this time. I'm now going to introduce our next speaker. So Dr. Janna Reaper is a professor of organizational behavior at the Smith School of Business, and that's at Queen's University. And she's going to be sharing today with us how to build highly effective teams, overcome adversity, increase staff rapport and culture building. So she has quite a bit of experience in this area, and she's looked at the literature as well. So I know she'll have lots to share. She's published in several top-tier journals and is a recipient of multiple Best Paper awards. So now please join me in welcoming Janna.
Thank you so much, Julia. And I get the pleasure of being the one who wraps up the comments because I think we've heard so many good sets of practices and new approaches that have already been used within this sector in particular. I should say from my perspective, I've been working with, my background and my approach has been to work with people across multiple different organizations in multiple sectors. So I work in the business school and basically track trends across all different organizations. I've been teaching on virtual and hybrid teams actually for 7 or 8 years. In particular, in cross-national organizations, hybrid teams have been the norm. And so this is an area I've been doing work in well before the pandemic. So of course, when everything went virtual during the pandemic, have worked extensively with many different organizations, trying to tackle initially the transition to virtual teams and fully virtual, and now just as much of a challenge, if not more of a challenge, to move to hybrid. It's, of course, no surprise to anyone that the new team reality at this point is hybrid. I think during the pandemic, many people thought that they'd be going back to how it was, but how it used to be face-to-face. And initially there was a lot of resistance to virtual. But then what's happened is the surveys during the pandemic were revealing that initially kind of 2/3, then 3/4, and now 80+% of people say that they want some form of hybrid work arrangement. And you've seen this throughout your organizations as well. There's a lot of benefits. And so I've just to give a little bit of a pulse on, what people have been feeling. Thank you. I asked people on a few different of my sessions, and this is just a word cloud that it reflects kind of thoughts and feelings towards fully virtual teams. And this was, I do this in most of my sessions, and this is just a couple of weeks ago, one example word cloud. where people are saying, okay, the upside of being fully virtual is, that you've got the flexibility, the convenience, and there's actually a lot of efficiencies that have been realized as well. People realized initially there was a concern that, oh, we're not going to be able to get much done. And instead it was like, okay, wait a second, we can actually be more productive, more efficient. And the evidence has borne that out during the pandemic as well, that productivity actually increased. It's been on the backs of employees though. And there's some challenges we see in here disconnected. Can we go to the next slide, please? When I ask the same question about hybrid teams, where people are from a hybrid perspective, what do they feel? It's not as positive. There's like challenging comes up really, really big, challenging, disconnected, inconvenient. So there's that sense of we want the flexibility. We know there's some disconnect, and it's disconnected regardless of whether or not we have virtual or hybrid. But there's so much concern, there's so much confusion, and honestly, most organizations out there right now they're struggling with this. It's wonderful we're having this panel session here today, because this is the time to be trying to solve some of those problems. Because if whatever norms you put in place right now are going to become part of the new culture that you have, and they're going to get solidified or institutionalized here shortly, and then it's going to be hard to change them. So now is the time for us to be figuring out how to make them more convenient, how to overcome those challenges, and how to make people become more connected to each other. I would say that even as a researcher and scholar in this area, I myself had a lot of hesitations about hybrid teams, because the evidence over the last several decades looking at virtual and hybrid type of environments is that they are often less effective than face-to-face teams. You have to work much harder. So if you as a manager and your team, you're seeing that it is much, much harder in order to keep people connected, that is indeed what the research has supported, and what the normative experience really is. It is harder. And they have to manage in a slightly different way in order to get your team to overcome these challenges. Next slide, please. The nature of those challenges really always comes down to three main things. So if you want a framework for clustering together what's going on, number one is isolation, and that's exactly what it sounds like. People feeling like they're working alone in their home. We saw this extensively during the pandemic, especially when people were just stuck at home and everything was closed. It's not as bad with hybrid teams. The isolation goes down a little bit more, and there's practices you can use. But there's still that sense of, well, why am I don't feel as I have the same cues. Maybe I'm getting left out. There's that distancing bias. I'm not there with everybody, so I feel like I'm a little bit more isolated if you're the hybrid attendee at a face-to-face meeting, for example. Fragmentation is the second big thing. This is when people are saying the culture is starting to fall apart, this is what they're talking about. The idea of, well, what's our purpose? Why do we get out of bed in the morning? What do we stand for? How do we serve clients? How do we work together? Who's doing what? We have all these local pressures, and those local pressures might be immediately in your team, or they might be, whatever you have going on in the rest of your life, where everyone has different things in their workspace now, and we don't have a shared environment to really have a shared understanding of who we are and how we do things around here. And that culture piece starts to dissolve when we have virtual and hybrid teams. And then the third piece here is confusion. That's about communication. So it's either too much communication, not enough communication, conflicting understandings of what is being communicated. So these are the barriers that come up again and again and again in the complaints that really can be clustered to these three areas. Next slide, please. I do have a little bit of a model, if you will, to kind of overcome these. And what I would suggest, I've got this slide and the next, really is about kind of where do we go from here? What a lot of the white papers and consulting firms who are doing this, because the academic literature is honestly quite behind because this is so sudden. So we don't have as much in way of kind of academic research specifically on hybrid yet, but it's coming. What a lot of the consulting firms have started doing is providing synthesized sets of discussions as to how to overcome this. And one in particular I like, there's a Gartner model that talks about, let's stop thinking only about location, whether or not we're virtual, or which we distributed, or whether or not we're face-to-face, which is co-located. So let's not just think about that, but let's actually think instead about the nature of the work we're doing. And I think this goes back to the model we saw. I think it was Andrea that mentioned who can work where and for what purpose. It's similar. So we need to start thinking, okay, so basically it's about interdependence. If we're going to be working together. So if we're working together, that's to say that we're doing deep collaborative tasks that require some sort of interdependence. And this is often the more complex type of work. So we need to solve problems, we need to brainstorm, we need to resolve conflicts, we need to do things that require discussion and in-depth, interdependent thought together. That's working together, or in some cases that can be working together apart. We need to try to prioritize face-to-face or deep synchronous communications, as in like really rich video conference, when we have to do those more complex tasks. But we also need to realize that if we talk about this meeting fatigue, the Zoom fatigue, the overload that people have also experienced, and the mental health challenges that also come with the isolation, but then also the demands of constant meetings and FaceTime, we need to also be prioritizing independent work. So that's working alone. And that working alone can be essentially asynchronous work that encourages people to have the time and the space to focus and concentrate. This is part of the reason why productivity has gone up during the pandemic in many cases, because people could actually focus and in their own spaces, not get interrupted all the time to get the work done, for those that didn't have to be on meetings all the time. So we need to have dedicated alone time and space where people can work as individuals. And then often that's better to be working alone apart. So rather than just thinking about where we're doing the work, let's think about what work we're doing and as to where it should be as well. Okay, next slide, please. Keeping that in mind, then, what I would suggest is there's 4 parts to my little recipe, if you will, for how to overcome isolation, fragmentation, and confusion. First, we have to make sure the teams and the team spaces are designed in a way that's actually going to facilitate hybrid work. Number 2, the next layer here is to make sure that we've got a virtual collaboration architecture that enables virtual communications above and beyond the face-to-face physical office. And then with everything, and honestly, I think trust and positivity could be, as well as team culture, could be part of all of it. It really kind of spreads throughout, but I have them on the top there. None of this works together if your teams have lost that spark, if they've lost the cohesion, the morale, there's no longer a sense of human connection, and there's no joy and contentment and enjoyment of collaboration together. And people have forgotten, or if people have forgotten why we do this, what the purpose is, which is our shared culture. So next slide, please. On the design side of things, this is where so many organizations are struggling that I hear. Going back to that working together type of approach is, what's the purpose of an office now? Why have a physical co-located space? If you're going to have people come together, if they're going to take the time to, get dressed, drive in, pay for parking, pay for gas, there needs to be a reason to come back together. Forcing people back to the office just for the purpose of having an office is not effective. People need a reason to come together. And that's where that working together does make a difference, because we need those human connections from a social perspective to overcome that isolation issue. We also need it from a managing culture perspective. So the purpose of offices, when people are being surveyed about this right now, is largely about collaboration, sometimes accessing resources or clients that you can't otherwise, which is very relevant to the sector. But then also the informal social fabric of the organization, to be able to have those opportunities to share a meal, to share a coffee, to pass people in the hallway and get to know people that you haven't seen in a while. We need those informal interactions. We also need to have hybrid technology that really prioritizes the ability to get those virtual attendees in a rich way. So the days of having the laptop on the table really need to be behind us. We need to have better hybrid meeting technology if this is going to be part of your organizational design. And it's also really good that the face-to-face, when we are together, it's really good for that cross-team networking to prevent those silos as well. And as people have also already said, we need the safety enhancements to make sure that people feel safe and back in the workplace as well. Next slide, please. I'll be quick about this. This idea of a virtual collaboration architecture is to say that you need to have a virtual space. Now, for many people, this has become Microsoft Teams. Most organizations have adopted Microsoft products during the pandemic. And so there's a virtual space that mirrors your physical space. And that this is where you're having just as many of those kind of asynchronous check-ins, and you spend a lot of time in your project room. This is where people talk together, they collaborate together, and they don't only show up for meetings. If the virtual collaboration architecture that you have is all about having video conference meetings, you're missing an opportunity for asynchronous communication which is the working alone portion, where we have to occasionally have the working apart portion that people can actually focus on their work by staying in the project room or the individual work room, essentially. So just as we need to focus on working together, we're in the office, we have to focus on working and not enabling people to work apart when they're in spending time in the project room when they're not physically co-located together. Next slide, please. Trust and positivity. I think many of you have nailed this. I heard this talked about already quite a bit, that we have to rebuild those connections for those that have kind of fragmented and become isolated. Those organizations throughout the pandemic that have maintained the social tools. I love the idea of kind of the huddles, the coffee house chats, the human connection of all sectors. I think you probably get that, the need for that human connection and the rapport. People need that, and they start to fragment and to disengage and withdraw from the workplace if they don't have it. And that builds the positivity as well. On the productivity side of trust, because some of it's about doing things, it's following through on what you said you're going to do. People really do need more reminders, more regular feedback. So as a manager, you do have to touch base a little bit more frequently, but try not to always just schedule 30-minute meetings or hour-long meetings with everybody, but you can do more pulse meetings, those quick check-ins with people, just to make sure that you're not forgetting and you're actually engaging, but it can be more regular, shorter pulses of connection to keep people engaged. Next slide, please. Last but not least, I would just say that from a shared team culture perspective, most workplaces fragmented at the beginning of the pandemic in terms of having to establish completely new ways of doing things. It's happening again. So the culture right now is being tested. Whatever your organization is, people are kind of questioning, who are we? What do we stand for? How do we what are our work routines? How do we communicate? How do we say hello and goodbye? How do we collaborate? All of these things, the fabric of the culture is fragmented. So I'd encourage you to think very intentionally about these questions, and then craft the culture, kind of think of the director, kind of people and culture. It very much is an art. Because you will have a culture, no matter what, you're going to have a team culture, you're going to have an organizational culture. It just might not be the one you want if you're not intentionally attending to these questions. In particular, I tell you at this point in time, try to focus upon hybrid work routines. Like, how do we get it done? Well, how do we collaborate? What are the norms? If we're going to have a virtual collaboration, a hybrid collaboration meeting, cameras on, cameras off. How do we actually, have that coffee house kind of chat, or the social chat discussions at the before and after the meeting, to make sure that everyone feels fully included. All right, last slide, please. I think it was Karen who mentioned this as well, that the hybrid teams are a work in progress. And the best way to think about this is that we're starting with our best first guess as to what would happen. I think what I hear from employees right now is those that are really frustrated are those that are saying, well, our management team has mandated that we do this, and this. And there's no logic for why we have to be in 3 days a week or 2 days a week or 2 days out of every 10. There's no logic for that. And we can do things differently. So rather than mandating that, this stay this way, see it as a work in progress. This is our best first guess as to what is going to be good from a hybrid perspective. But honestly, even in the scholarly literature, we don't have all the answers. So keep some practice. Try some practices, see what works, pay attention to the work routines that work very well and keep them, question and then change the things that don't work well. Be open-minded to the upward feedback, and also give the upward feedback if you're listening from a client perspective as well. So I know that was quick, but I'm happy to turn it back to Julia to go back to the panel so we can have more of a focused Q&A. Thank you.
Thank you, Janna, and thank you, everyone, all of our panelists today. We are now going to move into the focused discussion portion of our talk. If we can just see all of our panelists on the screen, then we have a number of questions. So we can stop slide sharing now, and then we'll just see all of our panelists on the screen. So some of the questions that we've thought of, and please continue to submit questions to the Q&A tool, because that will follow the focus discussion that we have for all of you today, are the following. So starting us off kind of easy, and anyone can answer these questions, any one of our panelists. So what do you think are some of the main differences between supporting our teams, pre-hybrid work and now in this new hybrid model? What is the main difference, or a couple of the main differences?
I can start. And so I'll just remind folks that our organization is unique in that we don't deliver direct care. So this is kind of like, we're a real office environment, right? And what I would say is one of the big changes is that I used to do a bit of a walk around at least a few times a week in the morning. When you come in, you have your coffee and you sort of walk around and say hi to everyone and sort of check in and see how things are going. And I'm really missing that. That's not something that we're able to do now. And I found that helped me to just sort of stay connected to people's lives, remember what's going on. I mean, children have grown in the last 2 years and people have changed jobs and all kinds of things have happened. So I would say one of the things moving forward that I think we need to try and figure out is how do you maintain that connection between ourselves as leaders and our team members so that they feel like they're connected to the organization's leadership, but also you feel connected to your team. One of the ways we've done so through the pandemic is by every Friday afternoon, I send an update from the week. So just sort of checking in and saying what's going on, sort of provincially in the child and youth mental health sector, but also things that are happening here at CHEO, things that are happening in our organization, like big events. Like I'll share that we had a really successful webinar today. But one of the things I did early on in the pandemic that I haven't done so much lately is add a personal note to that. So, making sure that I'm sharing something about my life or something about, something that's happening here in the office that not everybody gets a chance to see. So as this webinar has evolved, I've thought about how I need to start doing that again and being deliberate about sharing a bit more and making it a bit more personal rather than just a transactional information sort of sharing thing.
Does anyone want to build on that? I know Pranima was talking as well about, how to foster those authentic relationships, build that connection. So if you'd like to respond to that question as well, then yep, Andrea, go ahead.
Sure, I'll just build on what Pranima started to say there. It's more difficult to do that virtually, right? And it's more difficult to sort of try to maintain the equity to the point about, presence bias. It's easy to do that with the people that are in the office, and it's easy to forget about the people who aren't, right? And how do you do that in a meaningful way? One of the things we really was challenged with was, when people retired, or left the agency, how do you do those, acknowledge their contribution? And so, we were doing this trivia game. Well, by the 8th person, people kind of had it with the trivia game, right? Like you have to keep coming up with new and kind of creative and innovative ways to actually have a meaningful interaction and not just sort of a token interaction. And I think one of the big differences that I've seen is the challenge of being flexible. Staff say they want flexibility. That's really hard. It's easy to say, here's the policy, here's the protocol, it's right, it's wrong, it's blue, it's green, whatever, right? It's really hard when you're trying to work and operate and make decisions in that space of flexibility, because being flexible inherently means the answer could be different. And so managers are struggling with that too, right? How do you do flexible? It's harder. And so making sure that you have a really strong foundation, like a framework, guiding principles, some standardized criteria, so that those decisions that are being made flexibly are flexible, but are also kind of contained. You have to create the container for flexibility. It's kind of like parenting, right? Do you want red pajamas or blue pajamas? Not, do you want pajamas? Right. And so that's a challenge, I think, for everyone, that's different when you're dealing with hybrid teams.
I can add something too. I think, just with the nicer weather and having that opportunity to bring people together, I brought my middle management team together last week. We were masked, but there were, 12 of us, and we spent half a day. And basically what we did is people brought 2 pictures that they wanted to share about themselves that represented who they were. Because I had new managers join the team in the last 2.5 years. And also people were really missing each other. Well, I'll tell you, I couldn't buy this happiness. Like it was beautiful in the room to see the interaction, made sure I left enough time for it. And then the second part of the meeting was in small groups, people identifying what did they want to move from to. And it came up with things like, I'm feeling, overwhelmed. I want to move from feeling overwhelmed to having priorities. I want to move from a grind to complete tasks to joy and work. So just to even take the pulse that way in person and for people to hear each other, I'll tell you, we skipped out of the room after. It was just really nice, brought in boxed lunches people could take away. But for the first time in a couple of years or a year and a half, I felt some energy in the room and some relief. So just want to share that as well.
Just if I could build upon that too, I think this resonates with what those large kind of multinationals, for example, have done for many years, that you don't have to have people around each other every single day to get the work done. But what you do need to do is have these incredible retreats. They call them kind of the grand meetup or the meetups, where people do come together with purpose. And that, Karen, what you just described was an incredible culture building activity as well. So it's culture building, it's re-engaging people, it's reducing all those isolation, it's serving all these multiple purposes. And I think so many organizations need to do this right now. Like I saw the question about how do you, people fatigued with the virtual meetings. Well, don't do that virtually. Get people together for a grand retreat where you celebrate, you envision, you work together, and you can do it once, I don't know, a quarter, twice a year. Like, you don't have to do it all that often, and that will sustain people for the long haul if you can have that incredible energy occasionally.
Yeah, and it looks like this is very much a topic that folks are interested in and perhaps challenged with at the moment, because we have a number of questions in the Q&A about really how do we do that? How do we, create meaningful connections, engage with folks when, there is those other factors, right? Like we're fatigued with virtual meetings. So I'm going to move to a question from our Q&A tool. We'll just kind of flow back and forth in this portion. So how do you manage everyone's flexible working schedules, and what strategies are used to mitigate staff personal responsibilities or preferences that may have changed from more traditional 9-to-5 office hours? So I wonder, so anyone again can answer this question, but really a challenge about, how do you actually manage that flexibility piece?
I can start. I was just typing into the tool there that it really becomes about focusing on what gets done, not when it gets done. And so the other piece is being really clear about what are the expectations and the deliverables, and that changes over time. So initially, for example, in the pandemic, we said, do your best. Whatever you do today, you've done your best. That's all we're asking. Over time, you can't continue that, right? And so then it becomes, so, okay, you've got kids at home, so you have to work these hours, not that hour. Like we're really accommodating, you tell us what works, and we're focusing on the what gets done, not the when it gets done. And then it took a long time for us to say, over time, so maybe you need a more formal accommodation, if it's going to be a permanent change or something that we need to do that gets more formally accounted. And so I think it's a bit of a continuum, and you can go back and forth depending on what's going on and what's needed. But it's a big shift. It's a mind shift for managers away from the, I can only trust what gets done in the office. We've all managed people who don't do very much whether they're at home or at work. There are going to be those who are your stars, who are going to, do everything all day. And there are going to be a few who are not going to be overly productive. It's not a condition of where they are, right? And so if you can sort of think about, what are the expectations clearly, what are the deliverables, how am I going to have a check-in about the work that's done and worry less about when and where it gets done. I think that's one way that you can address that.
I think it's, giving people some tools. Like one of the best tools people said they got was showing them how to send a delayed email. So if people were working at 9 o'clock at night, their colleagues weren't getting an email at 9 o'clock at night. So showing people how they could deliver it actually at 8 in the morning when they open their computers. I think too, like you've said, it's kind of moving from, do your best to now there's more accountability, like the case notes need to be done within our policy times. We are starting to share now, we're going to share our first quarterly report with people around how many clients they've seen, how many interactions they've had. And given signal to people that we are going to start to do that. Like we need to get back to some of the accountabilities that were very important for us as an organization. So it's letting people know the shift is coming, and that actually doing that now. I think we've just started this quarter doing that.
All right, thanks for that, Karen. I'm going to shift to one of our focus discussion questions. So how have you supported team members at a time when human resources are stretched and many are experiencing burnout? So I think this is kind of leading from our how do you have this engagement piece, but now you have the other challenge, right, of a lot of folks leaving the sector because they're so burned out. We know we have, increased need for child and youth mental health and addiction services. So does anyone want to answer that question?
Can you repeat it again? Sorry.
Yes. So the question is, how are you supporting team members at a time when human resources are stretched and, there's this increased burnout?
I can start. I mean, one of the things that I'm sure everybody is, focused on is ensuring that team members are aware of EAP support. So employee assistance programs, if you're fortunate enough to work in an environment that has that as an offering, that's one. Another thing is there's a multitude of mental health supports that people can avail themselves of that are publicly available on the websites and so on and so forth. So I think making people aware of the resources that are available is one bit. But just, I think, two other things that I would offer. One is just making sure that people feel heard and supported. And so and from multiple folks, right? So I sent like I said, I sent this Friday update out, but also we had, I know folks are tuning in from across the province. We had a big storm this weekend. And one of the things that we wanted to do was check in. So I checked in with all of our leadership team and asked that folks connect with individual team members, make sure everybody's okay, that their homes are safe, their families are safe, and whatever supports were required, we would sort of try and brainstorm a solution. Now, thankfully, the biggest inconvenience was just really that many of us were out of power and nobody was really affected, but really important to check in with people. So I think keeping those lines of communication open are really important. The other thing that I have been reflecting on is this notion of this great resignation and this idea that people are leaving jobs in droves and what are we doing as a society? The reality is that people are leaving jobs, but people are also coming to jobs, right? So I think this is an opportunity that many people have taken to, yes, burnout, absolutely. But a way of moving from burnout towards something new is to actually reflect on what you do want to do with the rest of your career, how you want to spend your work days and so on and so forth. So I think it's really prompted a lot of thinking and really a lot of reflection on the part of, people that I work with, but also people across the province. And I think it's really just about letting people know, you need to rethink things sometimes, and maybe this is a catalyst for doing that, and we're supportive of where you need to head to next and helping people to get there. So that's kind of a few of the things that we're keeping on our minds here at the Knowledge Institute.
I would add to, one of the pieces, it's important for people to get, their performance reviews, like get back to business around, employee feedback. What are your goals? I think getting people excited about their work again, what's an exciting training that people can do, where, people are pursuing education, because I think it's changing the narrative a bit day to day around, do we have enough masks, to talking about some of the stuff that really gets people jazzed up about why they do what they do. And so, been highlighting opportunities with their managers so that they can share those with teams and get people thinking about it. We have a policy where we pay partial tuition, reminding people that policy is there, and what a great opportunity and timing for people to look at some education. I know, Andrea, you had mentioned like delivering meals as a special thing, to a staff home. we did something called lavender boxes and Craig's cookies. We had a board member who wanted to know how to support staff, and he donated money so that we could send to all the office sites and the program hubs Craig's cookies and these containers full of candies. Well, people talked about that for a couple of days. Just it changes the conversation and the focus. And I think continuing to show appreciation is really helpful.
Thanks, Karen. I think we have time for maybe one quick question and then we'll wrap up. So this is another question coming through the chat that I know folks are asking about. So how do you find balance in supporting individual needs while maintaining that equity among team members, right? So we know staff have different access to resources when they come in. There are different requirements. They might have to pay for parking if they have to come in. So those kind of considerations. Again, this question is for anyone.
I'll take a stab at it to get started here. Just in terms of, I think this somewhat links also back to the frustrations and some of the burnout that people are experiencing as well, because there's these things that have just kind of slowly started to fester over a period of time. And we don't have what Karen was just saying in terms of as much of that kind of interest in the positive side of work as to help to mitigate some of these concerns. So I guess there's two things I would think of here. For one would be actually getting people focused upon their work. And so there's been questions that have come up about, how to manage work in this environment. And years ago, there was this trend called results only work environment. And that's essentially what people have to focus on doing like their work, their productivity, their results. And, if you make it so that each person is managed according to their workload, what their expectations are, what they have to accomplish, you set the goals, you give the feedback according to what their work is, it becomes less about, well, I have to do this and this person has to do that. And it becomes results only, which is, well, this is my workload, this is what I do. And what someone else does is a little bit different. And that's okay. This is how we've managed, many people in many organizations for years. The second part of that, though, I would say is that I do think this is a discussion for the HR or for the management team to say, okay, look, if people are mandated to come in twice as much as somebody else, well, maybe there should be parking covered. Maybe there should be some other resources provided in order to help to mitigate there. There is a legitimate fairness issue in there as well. So some of it's kind of petty, like, oh, me versus the other person, like fairness issues, but some of it's legitimate. And I think I guess one more thought there was to that, what Karen was saying about kind of re-engaging the positive. That's a lot of burnout as well. People don't really have anything to look forward to, that hope, the optimism, the forward thinking, learning oriented. And I think that focusing on the positive and growing that positive side of the culture and engagement will help a lot towards mitigating some of the fairness concerns as well.
Thank you for that, Janna. I really appreciate that. Okay, we're at 12:58, so I'm just going to share a few reminders for us as we wrap up the session today. So thank you, first of all, to all of our panelists today and all of our attendees submitting the questions. I know I will walk away with a few different tools and ideas to implement, and I hope folks here will too as well. So right after the session, you will receive a brief evaluation. So as you close your exit out of this Zoom, you should receive that. Please take a few minutes to complete this, as we have a number of other sessions planned. So this is just going to help us to adapt our sessions as we go. And we are also going to share key resources. As we mentioned, the session today is recorded, so we'll send you a note when that's available so folks can access it. And Pranima mentioned that we have a tip sheet coming up. So we actually are compiling a lot of this literature. We're going to compile some of the pieces that were discussed during this webinar as well. And we'll have a tip sheet available later this summer on the topic. So then our next session, just wanted to create a brief plug for our next session as well. Our next session is building on today's theme, and that's also in collaboration with CMHO. So that's building routines, rituals, and resilience in our hybrid workspace. So we're looking forward to seeing you all there. Thanks, folks, for joining us, and have a great rest of your day.